central suture and the end of the long axis of the wound. Again, an instrument tie is used to fashion the square knot. 4 throws are used to be sure that the knot is secure. Skin sutures are then placed according to the principles of halving. The first or central suture is placed midway between the long axis of the wound. Note that the edges of the wound are both approximated and everted. The skin suture is cut with a tail. The remainder of the skin sutures are also placed according to the principles of halving. Here we see the defect. An incision is being made around the defect, and then the limbs of the note flap will be created by making a line as a tangent approximately 1.5 times the length of the diameter. Here we see the lesion being excised. Once this lesion is removed, the other limbs of the note flap are drawn. There's the first limb. It's approximately 1.5 times the diameter at approximately as a tangent. And the second limb is now cut. That is the diameter of the lesion at approximately 60-degree angle. Now the dissection begins at the apex, at the 60-degree angle apex, and it is widely undermined so that the flap can be rotated into the circular defect to close that circular defect. We will have some excess tissue at the apex of the flap that needs to be trimmed. Now, the first suture is being placed, as we see in this example, from the apex of the flap, from the tangent of the circular defect. That's the point of maximal tension. The second suture is now placed. It's placed at the flap as it's being rotated into position. Notice this is a triangle being rotated into a circular defect. So we need to be able to trim the excess of that flap so as it fits and it will inset nicely into the circular defect. Here we see the dog ear. So we place a suture to close this end of the flap. Placing it in position, we can see the dog ear has now been created. We will remove that by making the back cut and then sewing that into position. Here we're now closing the remainder of the flap. You can see there's a triangular excess which will need to be trimmed and inset properly. And again, another suture is placed at the apex of the tissue so that all limbs of the defect are closed. And the remainder of the tissues are closed according to the principles of halving. Now we can see that there is this excess. We now will cut this triangular excess off so that the flap will inset nicely into the region of the defect. This can be trimmed off with either a pair of scissors or with a 15 blade. And now the final stitch is put into position to close the wound, and the flap is now nicely in position, closing the defect. Here we have the dog ear. A hook is placed. The line of the back cut is marked. Always place the hook at the apex of the dog ear and always cut away from the flap, so you do not want to interfere with the blood supply. The back cut is now made. We can see using the hook that we have excess, and this excess is now trimmed off, removing the dog ear and allowing the flap to inset nicely into the area of the defect. This is a relatively fast and easy technique to remove the dog ear. And now the sutures, one or two may be placed depending upon the amount of tissue that needs to be closed. The sutures are now placed to complete the closure of the wound. Here we see the excision of the circular defect and the closure with the note flap. The rotation flap is utilized to close a triangular defect. The rotation flap follows a smooth curve from the site of the defect. It then gets rotated into place. Typically, the limb of the rotation is approximately 2 to 4 times longer than the axis of the defect that it needs to close. This is a flap with a very large vascular pedicle, and it is extremely useful for facial reconstruction. Because the skin edges have already been incised, the defect can be completely excised with scissors. The flap is then incised with a knife, broadly undermined under the entire flap, as well as 1 to 2 centimeters beyond the skin edges of the defect. Test rotation can be done intermittently during flap elevation to determine whether the back cut is enough. The key suture is then placed. An instrument tie can be used with this flap design because there is not a significant degree of tension. The flap edge is then closed to the longer skin edge using the principles of halving, splitting each side in half for subsequent suture placement. Now we have an example of the rhombic flap or rhomboid flap on a pig's foot. The limbs of the flap are of equal length, and the angles are again 60 degrees and 120 degrees. The lesion is now excised by utilizing 15 blade and then picking up the edge of the lesion and now dissecting it free with a number 15 blade down to the subcutaneous tissues. Notice also the other limbs of the flap are the same length as the parallelogram of the rhomboid flap. The angles are approximately 120 degrees and 60 degrees, and that's how the other limb of the flap is fashioned. And now the incision is made along the superior limb, and now at an angle of approximately 60 degrees the second incision is made, mobilizing the flap now with a pair of dissection scissors with the tips up. Again, you may use a 15 blade or dissection scissors. Be sure to widely undermine this tissue, and again the tissue may be undermined using scissors or a 15 blade. You want it widely undermined so that the flap will be rotated into position so that it is not under any extreme tension. Notice the wide undermining in this particular case. Once the flap and adjacent tissues are widely undermined, then the flap is rotated into position. With the point of maximal tension of the flap here is seen with the first suture. All apices of the flap are then sewn. Here's the first suture at the point of maximal tension. It is at a corner. A corner stitch is not necessarily needed in every case, but you can see how nicely this flap is rotated into position to cover a defect. Now the second suture is placed in again at the apex of the flap, and again it's possible to use a corner stitch if